is Pastor Derek Rice, a regional representative of the Samuel DeWitt Proctor Conference, and I am very excited about this opportunity to welcome you to the Progressive Hour, a product and presentation of the Progressive National Baptist Convention Incorporated and the Samuel DeWitt Proctor Conference. And for this entire month, we've been celebrating Black History Month, as well as keeping our eyes on the many circumstances that impede the well-being of our communities. The Progressive National Baptist Convention Incorporated continues with its theme, In Pursuit of Wholeness, Maximizing Our Potential. And the Samuel DeWitt Proctor Conference continues with our theme, The Journey to Justice, Between Holy Rage and Holy Hope. And thanks to the leadership of Reverend Dr. Timothy Stewart, the Progressive National Baptist Convention President, and the Reverend Dr. Ivor Carruthers, the General Secretary of the Samuel DeWitt Proctor Conference, you, our faithful ministry partners, will be equipped with information that you can actually trust as you continue to navigate life during these very unprecedented times of uncertainty. And we covenant with you to bring you critical knowledge that matters to all of us. This progressive hour is our hour. And we invite you to please take a moment to share this broadcast widely with your family, with your friends, and your social media followers. And we thank our sponsors that help to make this program even possible for us. The Coalition to Transform Advanced Care, or CTAC as they're also known, and the Savannah Grove Baptist Church. And today we have a very important conversation about health in a time where all of us are at least thinking about vaccinations. And many of us have to be at least concerned about what one scholar called medical apartheid, the ways that are indelibly etched in some of our psyches that our ancestors were used for medical experiments without them even knowing about it. Our panelists today are none other than the Reverend Dr. James E.K. Hildreth, the president of Meharry Medical College, Reverend Dr. A. Ovida Fuller, who's an associate professor of microbiology and immunology at the University of Michigan Medical School, Reverend Dr. Gary V. Simpson, the leading pastor of the Concord Baptist Church of Christ, and Dr. Choo Onwachi Saunders, the medical epidemiologist and pediatrician par excellence. And our moderator is radio and TV host and political analyst and commentator, lover, and liberator of the least of these, my friend and my comrade, none other than Reverend Mark Thompson. Put on your seatbelts. This is going to be a very important and riveting conversation.
We will begin with you, please, Dr. Hildreth. First of all, describe for our audience the role you played with the FDA in approving the vaccines.
Thank you, Reverend Thompson, and thanks to the organization for putting this very important conversation together. Actually, my colleague and I both, Dr. Fuller and I both served on the Vaccines and Related Biological Products Committee of the FDA. And what we do is we take the data from the vaccine trials, we review it, and make decisions about whether or not the benefits outweigh the risk, considering all the data they provided to us. The immunological response to the vaccine, the reactions to the vaccine, the level of antibodies generated, the level of immune responses that are made. So this group of about 20 experts, we get together, we review the data, we make recommendations to the FDA.
There was no hesitancy on your part in terms of the vaccines as they were presented to you for approval.
I wish that the number of African Americans that participated was a bit higher. 10% of the participants were African American. I wish the number had been higher than that. But the thing that I got some comfort from is that the number of people with underlying conditions, heart disease, hypertension, obesity, asthma, there were substantial numbers of persons with those conditions in the trials. And as you know, African Americans suffer from those things disproportionately from others. So we wanted to make sure that the vaccine worked in those individuals and the data were strong in people with underlying conditions. So I was very, very pleased to see that.
Dr. Fuller, you were a part of the approval process too. What was your take? Were you comfortable with the process and equally comfortable with approving these vaccines?
Well, thank you for the question and to the sponsors of this important event. So yes, I was on the FDA advisory committee. That was my first meeting with them. I think Dr. Hildreth had been there before. And I'll say I had a little bit less enthusiasm about these vaccines, and I'll tell you why. I do believe they're a major tool in our toolkit against COVID-19, and I think they're necessary, just as I believe prevention, such as masking and distancing and staying home, are necessary. But I am one where if you tell me what to expect or tell me what I even what I don't want to hear, but let me know that, then I can make up my mind and act from a place of being informed. So whereas they told us what was known, there are questions that I had at the review and that I still have. And some of them we may not know until we know, because the timing is such that we won't know the long-term effects until we've used these for a long time. But I wanted to know, and now this is coming out transparently, do the vaccines, besides the 95% effectiveness at blocking disease, which is a huge big deal. Let's not run by that. That is a major, major plus and a reason to get these vaccines if there's not some underlying condition that would prohibit it. But do they block infection? Do they block the ability of the virus to be transmitted from one person to another? Because when they block disease, that's going to help us stay alive, which is key. Don't let me run past that. But it's not going to be the magic vaccines that we've seen with measles and mumps and rubella, or with polio or smallpox, that got us out of those pandemics. So we're still going to have to use our masks. We're still going to have to use our public health preventions. And I wanted to know, do the vaccines block infection? We don't know, but that data is coming, hopefully. What are the short-term effects in a wide variety of people? We've had them in, let's say at the most, 60,000 people, which is a lot if you take both of the vaccines. But now we're going into millions of people with many other genetic underlying conditions. So what do we know about that? And so a lot of the questions I had, we cannot have answers to at this moment. And so what I've done in my own estimation is that what's the risk, as was said earlier, what's the risk of the disease and the outcome, and what's the risk of the vaccines? And so for my vote, the risk of the disease are much, much greater than the known risk of the vaccines. We're in an experiment either way you look at it. And for me, I think the greater harm can come from having COVID run rampant as it already is versus the vaccines, which are 95% effective and safe over the short term where we've looked at it. So for me, I wanted to know more, but they can't tell me more than is known. And so we go with some risk, but the lesser risk is the vaccine.
Dr. Chu, I'm sorry, Dr. Hildreth, do you want to respond to that? Please.
Yes, I want to make one comment about the expected long-term risk. One thing that people should know is that this platform of messenger RNA has some very appealing properties for me. Messenger RNA are the templates in our cells that allow our cells to make proteins. They're very transient. They don't last more than a few minutes or a few hours normally. These two mRNA vaccines are in our cells no longer than 24 hours. They're gone. The protein only lasts for 24 hours and 72 hours and it's gone. So the prospect that there could be long-term damage from these vaccines is as low as we could possibly make it. The reason I can say that is messenger RNAs do not affect our genes. They have no ability to affect our genes. There is no chance that these vaccines will modify our DNA because there are certain sequences you'd have to have on RNA in order for that to be converted to DNA. That cannot happen with these two vaccines. They're very transient. They're only going to last for 24 hours in our cells. They're gone. The protein is there for 3 days and it's gone. So the prospects for long-term harm are as low as they could possibly be. And that is one of the reasons I felt very comfortable with this. The other thing is many people have said, this is a new technology, so I should not trust it. Messenger RNAs were discovered in 1961. The first human study was done in 2003. This is not a new technology. It's new to vaccines, but it's not new to medicine. Those are some points I think that are very important for people to know.
Reverend Thompson, I know you want to get to other people, but let me just say, I totally agree with him. we are in the same place. My concern is not so much that this vaccine technology isn't understood. It's really COVID is not understood. It's the disease that I'm concerned about. It's not the technology. So whatever vaccine we put in ourselves, we're boosting the immunity to a virus that is currently circulating. And I just don't know what a boosted immunity with the currently circulating virus is going to do. And we can't know. So that's not a reason to take it. It's just that it's something I want to know that I don't know, that I have to take in consideration. So I'm going to stop now so you can talk to somebody else, but
Just to be
we're
clear,
in agreement.
just to be clear on what you're saying, Dr. Fuller, that's not a reason not to take it, you mean? In other words,
Absolutely. The
yeah, right.
messenger RNA technology is actually a good reason to take it. It's a nice, clean vaccine, and is what my colleague has said. The reagents don't stay around very long. So, of all the vaccine possibilities, this is a very good platform. It does not modify your genetic material, as he said. So, it's a nice, clean vaccine. That's not the issue. It's the issue for COVID-19. There's so much we don't know about COVID that concerns me. And the vaccine is now trying to modify a disease that we don't even understand. That's my concern. And we can't know. We can't know. So we just have to step out in faith and say, let's do what we need to do to stop this pandemic.
Right. Dr. Choo Choo, what are your thoughts about the process as Dr. Hildreth and Dr. Fuller have explained it? And what are your thoughts about the vaccines themselves?
I too would like to thank the sponsors and you, Dr. Thompson, for having us here. I also would like to send out sympathy and condolences to the millions, well, actually, I should say thousands, and also the millions of people that have been adversely impacted by this disease and have possibly lost a loved one. I think every time we speak about this, we need to acknowledge them because so many people are going through so much and they just can't see the light at the end of this tunnel. Thus far, I agree with both of Dr. Hildreth and Dr. Fuller's comments about the vaccine. I think what you really want to get at is the issue why so many of us are afraid of it or are not taking it or refuse to take it. I just read an article yesterday in the Washington Post about how many workers, our essential workers in nursing homes, are still refusing to take this vaccine. And I think the issue is one of disinformation and misinformation that has happened because we are such a public information system society. Everything is on the internet and people can't make a difference of what's real and what's not. And also, we just don't have enough trustworthy organizations speaking that people can go to and know this is where I need to go to make to understand what it is I think I'm reading, and I think I have an understanding around. Clarity is the issue here. Our people just don't have clarity. And so I think some of the statements that I've heard Dr. Hildreth and Dr. Fuller say, I don't think people have heard that. And they need to hear that. They need to understand simplistically what this vaccine does. Because remember, even though we have this distrust in our communities about vaccines, many of us have taken those many vaccines. I'm also a pediatrician, and you couldn't go to school if you didn't take your vaccine. So your parents made you take them, and we all took them, and we're all here, and we're still alive. So I think that the misinformation and the disinformation is the problem. And I think the clearer we get from our experts, people that our people can trust, I think people will begin to take what is necessary for them to take to beat this disease. But I also would like to caution that this is a disease or a virus that is really throwing us for a loop. Many, many times, many people speak with authority and they shouldn't be speaking with authority because we still don't know a lot. Here we have today different variants of it. And, and here the vaccine companies are scrambling to say, oh, our vaccine covers those variants, right? But we're not hearing definite information. So that again adds to it. So I think taking a posture of we don't know, which I appreciate what Dr. Fuller was speaking about. She said, I don't know. That's, you don't hear too many professionals saying. You just don't hear it. They want to give the answers. And in many instances, there are no answers. There are none.
Yeah, it is. It is definitely a process. We've heard from the medical experts. I want to turn to the Reverend Dr. Gary V. Simpson. Dr. Simpson, your job is to inform and educate and mobilize the entire Black church community, you by yourself, to feel comfortable with this. And, you know, with everything that's been discussed, we know that's not easy. People do have questions. I think Dr. Chuchu put it well. When people have access to so many different things on the internet, you know, it can be very confusing, misleading. And we are in a greater era of disinformation than we've ever been in. That means everyone, not just Black folk. I hear from white folk, I don't know if I want to take the vaccine. So first of all, give us an assessment, if you would, be it from your church or anecdotal evidence or information from the PNBC as a whole. What kind of feedback are you getting from parishioners as to their comfort level with the vaccine? Let's start there.
Well, I am indeed happy first to be in the presence of experts who actually have the answers, the experience, and have put time in on this. So let me thank the panelists here for their presence here. This goes a long way as a pastor, to be honest with you, because we see experts who would resonate with our experience, who would know our history, who would know. I keep hearing people talk about the Tuskegee experiments, but even before that, the first quote unquote gynecological doctor started in doing experiments with Black women, thinking that because they were animals, that they could endure pain better than white women could. So there's a whole history of distrust in the medical profession. It is remedied and countered by seeing Black scientists and physicians who are working on these things. So as a pastor, I am grateful. I am also grateful for the opportunity to have things explained simplistically so that we understand the kinds of information that we need to know, given what Dr. Saunders has said about the misinformation and the intentional disinformation that happens in communities. What I can tell you is that when COVID-19 first struck in this country, it struck in New York. I pastor in Brooklyn. I watched the disproportionate. I didn't need anybody to tell me, you know, what the statistics were. I watched the disproportionate effect on Black and brown people. We have had, since the COVID began in our church, 40 deaths in the people in our congregation. And I have been in that space with people at a time at which, and I again agree with the panelists, this is such an unknown virus itself that it changes, and our understanding of what is happening changes over time. I can say that my participation in this panel is also to say that the vaccination itself is but one part of the large conversation, not just about COVID as it continues to create variant strains, but also the long-term effects of the illness itself. And how it is not just physical. We have to also talk about trauma. We have to talk about the trauma that people have been in, and the long-term effects after we have the vaccinations and after we do at some point get to a herd immunity. After we do that, people are still going to have long-term effects, both physically perhaps, and certainly mentally and socially. And the need to talk about mental health as a part of our response to COVID-19 is also very important, and that would be helpful to pastors and church communities.
But in terms of your congregants, are people hesitant still, or are people open to taking the vaccine?
I think you have the spectrum, as you do in all Black communities, and I think in conversations sometimes we believe there's a monolithic approach by Black people, that we are also a very diverse community too. In my own church, there are people who have had the vaccination already, who have qualified. We also sponsor a nursing home which is adjacent to the church. And we are seeing some of the challenges, as was already mentioned, that some of the workers in the first round of the vaccination were hesitant to get the vaccination themselves, and as well as the residents. I think that again, the important thing is to create the space so people can get the information at a level in which they can receive it, and for them to make the best informed decision, as Dr. Fuller has said, the best informed decision based on the information that they have. And that's what we're trying to do in churches at this point.
Dr. Hildreth, if I understood you correctly, one of your concerns when you were speaking earlier is the small number or lack of African American representation in the trial and development, correct? Why was that the case? Was it because African Americans, because of our history, we weren't willing to participate in these trials? Or were there other reasons? Were the vaccine developers themselves not as effective with outreach to African Americans?
Reverend Thompson, I think it's a combination of all those things, the hesitancy on the part of African Americans. But one thing the drug companies did not do is they did not elicit trusted organizations to enroll people in the trials. I've been saying this to anyone who will listen, without trusted messengers, all the things that we're trying to do are going to be much more challenging. My research career has been in HIV, and part of my work was to find ways to get prevention messages that people could understand and accept. And one of the things I did here at Meharry my first time around was to start an organization called the Spread the Word Coalition. So physicians, researchers, and pastors of Black churches, we got together to come up with ways to inform the community about how to protect themselves against HIV. And as a matter of fact, Reverend Dr. Fuller was one of the people we engaged in that work. So I'm a strong believer that, and as the pastor has said, Dr. Simpson has said, we got to have people who are trusted messengers, trusted organizations. And I think the drug companies have finally learned that without that, they're not going to be very successful in enrolling people in their studies. And so I think that's a very important concept that we cannot lose sight of. And I think Dr. Saunders has mentioned that as well.
Indeed. Well, I mean, I think that those of you gathered are definitely trusted messengers. And we need to hear more from you. Would you not agree, Dr. Fuller? And is it worthwhile organizing people in both the medical field and in the community leadership and pastoral fields to answer questions, to first of all, be empowered with information to answer some of the questions that our people have?
Absolutely. Absolutely. You're talking to one who, as was mentioned, I am also a former pastor and a microbiologist. And one of the things we do now for our research is called a trusted messenger intervention, trusted messenger approach, where the idea is to move science and medical developments into community through the powerful networks in the community, one being religious leaders. And so that's as has been mentioned, that's a very powerful way of getting our people to understand and to see people they trust communicating to them things they need to know. And I just wanted to follow up on your question earlier. In the work that we're doing now with talking about COVID and the COVID vaccines to under various invitations to church leaders, community leaders, even some universities. So I did something recently with a major university in Michigan for their College of Veterinary Medicine. And we do these polls before that ask, would you take the vaccine? Yes, no, or not sure. Well, in the African-American community, when we ask that question, we get about 40, on average, about 50% of the people say yes, maybe a little less sometimes, but at least 50% saying not sure or no. When we did this with this university group, which was predominantly not African-American or not people of color, immediately the answer yes was 83%. And so what I'm concerned about is even with the unknowns of coronavirus, COVID disease, and the vaccines, that the train has left the station. These vaccines are available. They are highly effective at blocking disease, which, as we've said, is a huge piece. So I don't want to look up 6 months or 8 months or 10 months from now and find that the people who didn't get the vaccine and who are having now the most COVID cases, the most deaths, the most circulating virus in our families and communities are people of color, because for whatever reasons, either those of us who are trusted didn't get the message out, or people didn't believe us, or for whatever reasons. We don't want that to happen. We have so much disproportionate illness in our communities that it's time to change that. And so we need to use every tool we have, including these vaccines, including the preventions that we've already known about, that overall, as the population in the USA, we have not done a very good job at. We need to do everything we can to stop this particular pandemic. And so, yes, we need to use our religious leaders, our divine nines, our whatever we can use to get the message out of how to stop this virus and many other illnesses.
You said something earlier, Dr. Fuller, about risk, and the risk being greater not taking the vaccine because we know what COVID has been doing. Dr. Chuchu, you talked about the disinformation. Something has to be wrong because I did that calculation in my own mind. This is a fact. We are disproportionately dying from COVID. We are not, this is a fact, disproportionately dying from the vaccine. Okay, so to me, that's just a pretty simple process of elimination. Something must be missing, because I know that we're disproportionately dying from COVID as African Americans, Dr. Chuchu. I would assume that most of our sisters and brothers in the African American community, many of our church going members must know that, Dr. Simpson, or am I wrong? Because if we knew that, if we really understood that, I'm not quite sure, in spite of, and it's valid, the Tuskegee concerns, the medical apartheid concerns are real. But in terms of risk, and then we have African American messengers right here, they need to be seen more on some of these major media networks, by the way. I just want to say that we need to see more of you all. But it just seems to me that if we had the full awareness of the disproportionality COVID is having on our people, we would not necessarily be so hesitant, Dr. Chuchu, to take the vaccine. Or am I being naive?
I'm not going to call it naivete, but I will say that that doesn't always hold true for us as a people, because of the mistrust that we have, and because of the speed that it took them to develop this vaccine. Because remember, there was a lot of controversy about it in the beginning, and people were listening to that. Remember, they said we wouldn't have it in a year, or that they thought 18 months, or if we do, it'll be rushed. And then everybody began to hear about emergency use authorization, which most people don't understand. It generates a cloud of mistrust again, right? And that mistrust then is not backed again by, as we've just pointed out, by people of color who have the expertise to speak on that. We're not speaking enough. You're right. We're not on the airways. All the experts I've heard from do not look like me, even though I've had the same experience as most of them have had. I'm a CDC trained medical epidemiologist that's worked as a public health professional my whole career. What don't I bring to the table? But we're not there. And one of the things, let me give you a really good example of this. Do you realize that if you take the vaccine, your behavior should not change? Before you took the vaccine, the preventive strategies we want you to put in place. After you take the vaccine, that's important. Our people don't know that. They're not hearing that. I think that's important to say. That's important to say. This is not a bulletproof vaccine. Yes, it might prevent you from getting, as Dr. Fuller has put out, it ameliorates the disease process. It doesn't prevent you from getting it. You might still get COVID. You will still might get a COVID positive result. We don't know. These are the things I'm saying that we as professionals who know the ambiguity need to speak about. And when our people hear that, they become more comfortable. They become more comfortable. Like, as Dr. Hildreth said, I've been on this bandwagon with public health strategies. They take a while, but if you keep at it and you explain to people and you bring the clarity into FO, it'll work. And I don't think it's been done with this disease. And I'm not blaming anybody because I know it's been something that has hit us quickly. Many of us, a lot of people don't know what to do, but I'm just saying we've got to stop a minute and pause. And that's what I tell all my friends who call me and ask me, should they take it? I say, pause, look at the research, definitely talk to your healthcare professional because you may not remember something that you're allergic to that they might remember. And remember that even if you do take this vaccine, your behavior cannot change. As a matter of fact, I would say intensify your behavior as it relates to preventing this process because people tend to let their guard down when they do get a vaccine. And that's not what we want.
Right.
It won't give us what we want. It will not give us what we're looking for. And that I have not heard anybody say that.
Yeah, amen. Thank you. Dr. Simpson, have you a found a theological argument or moral argument to encourage your congregants and Black pulpits and Black churches in general to encourage people to take the vaccine?
I think we've heard one today. I don't know if we're going to find a Bible verse for this, but I do think that to trust what you have heard from people who can articulate it. Part of this is just recognizing that the faith and theology is not so much about having the right answer. So many people approach their religion, look at the Bible for an answer. The Bible really is an opportunity to create the questions, and we have to frame our questions right. If we do anything to teach people things in this age of ambiguity, as a pastor, I need to have people ask the right questions, because so often we ask questions that don't help us to get to good solutions. And so what are my chances? And what are my chances? I have to ask of taking the vaccination. I am going to take it when they finally get to me in the list of people. I am going to take it. I am clear that I have a responsibility. Also, if you ask for a theological reason, this virus has hit us at one of the most vulnerable places in American culture, and I'll talk about this country particularly, and that is underneath everything we do and say, we are very selfish people. And this virus has people fighting about what their rights and responsibilities are, as opposed to the good of the community, as opposed to what we should be doing to love our neighbor. There is the passage. How do we love our neighbor as we love ourselves? And a part of that is being responsible. I don't want anybody bringing me something unbeknownst. And so one of the jobs I have is to model for the congregation. We have not been in our church since the 15th of March. We've been meeting just like this in Zoom, because I am afraid that unbeknownst to us, we may unintentionally infect somebody that we love and care about. I don't want that responsibility or that weight upon my shoulders. The best thing I can do to love my neighbor as myself is to stay at home, practice the things that have been spoken about today, and make an informed decision that, yes, I am going to take the vaccination when it is available to me.
Reverend Thompson?
Yes, please. I was coming to you next, Dr. Hildreth, please.
I wanted to follow up on a comment that Dr. Saunders made, where we're not to blame anyone for this. Well, I do blame someone for this. We knew from the very beginning that this disease was going to disproportionately impact people of color. We knew that by looking at the people in China. China is a very racially homogeneous nation. But if you were obese, smoked, had heart disease, hypertension, asthma, diabetes, you were going to get more sick and die from this than others. Who in America has the disproportionate burden of those things? We do. We saw from the very beginning that this was going to happen. As soon as it was made public that older people, brown people, and Black people were disproportionately dying from this, guess what? It seems that the leadership of the nation turned its attention elsewhere. So yes, I'm blaming someone. I'm blaming them for sure, because racism again, as it does throughout all of the fabric of America, raised its ugly head. So yes, I'm blaming some people. I apologize, but yes, there's blame to be assigned here. Yes, there is.
None to apologize for. Amen. I think we would all concur.
There's nothing to apologize, and I don't want you to. I hope I'm not giving the impression that I don't believe that racism played out in this at all.
No, I wasn't trying to say that. I just think that's something that needs to be said out loud because it's true.
Yeah.
We could have done so much better, and lives could have been saved, and livelihoods that have been lost, and children who've lost their educational opportunity if there had been a national strategy from the beginning. But that's water under the bridge now. So we can go back and say that was the case. But here's what I want to look forward to, and that is that you asked for a theological basis, and you were given one. We need to do this for ourselves. But if I said when the vaccine was available to me that I might pass it by for two reasons. One, I want some more information about some things. But two, I am not at greatest risk. I'm here at my home. I teach from here. I don't have to go out unless I have to go out. But my mother, who's 96 years old in North Carolina, lives in her own home, and she has underlying conditions. And if her grandchildren or great grandchildren come to visit her, or even her healthcare provider bring the virus to her, she's at great risk. So I said, when the vaccine becomes available to my mother, I will take her immediately to get that vaccine because she needs that protection. And now I've actually already taken it because I realized, one, the opportunity came around twice, and I'm like, well, I better go ahead and do this. But the other piece is the responsibility that we have to protect our neighbor. Whatever I want to do, if I want to take vitamins, if I want to stay home, if I want to do whatever I want to do, that's up to me. But if now my taking it helps to protect everybody else to get to herd immunity, isn't that what we're supposed to do? And that's what I think we lost sight of in the USA. That's why our amounts of virus have been so high, because of lack of leadership and because we are so individualistic that we want to do what's right, what I want to do. If I don't want to wear a mask, I won't wear one. That is so wrong. And so I agree with the panelists that we need to inform our people so they know all the tools available to them and can make informed decisions, even if their healthcare provider doesn't give them the advice that they need to get. Let them have somewhere else to go.
Hey, at this point, I just wanted to come back to you to remind you of the importance of making sure that we get this kind of powerful information out to our entire community. And the way that we do that in these days, in this age, is that we want to encourage each and every one of you who are watching right now to please subscribe to our social media and YouTube channels. Click like while you're watching this powerful information, and invite other people while you're watching to join in this conversation. You can find us on Facebook and YouTube, and the two handles are very easy: at Proctor Conference and at PNBC INC. At Proctor Conference and at PNBC INC. God bless you. Please click, please invite, and please invite people to come and join in this conversation.
I want to say also that not only was it racism that played out, that adversely impacted most of us of color, all of us of color, I should say, but also the fact that the leadership, I'm going to say this, was not a public health leadership. Public health should have been at the forefront of this pandemic. It was not at the forefront. And that's the other reason, because when I know as a public health professional, when you deem someone as an essential worker during a pandemic, then you make sure they have adequately what they need. And that was not done as well. We deemed many of our people essential workers because they're in those positions, and they were constantly re-exposed to this virus. And that's what brought it back into our communities and affected our people. Let's be real. I'm not saying that the underlying diseases weren't a factor. If you were exposed and you got the virus and you had an underlying disease, but the exposure itself was heightened for our people because they're essential workers and they were repeatedly traumatized. They had to repeatedly go. And I also agree with Dr. Carroll, Reverend Carroll, because the mental health impact of this on our people is going to be with us for a while.
Yeah.
Because there are many people who know they had to go to work, went home, exposed their loved ones, and they're no longer with them.
Exactly.
Or they're suffering from some morbidity and mortality. So it's not just the racism, it's the fact that the right professionals were not leading this in the beginning. And I can say that as a public health professional.
Is there any, because we talk about taking it, and I wonder if we take that for granted as well. Is there racism and discrimination in the rollout and the distribution to our community? Are we having the access to it completely that we should have? Now, Dr. Hildreth, I don't want to bring up anything negative necessarily, but if I'm not mistaken, you were on the FDA piece, and yet Meharry didn't get the vaccine like it should have gotten that night.
That's correct. We were left off the list that was generated, but thankfully, the hospital systems and the city respect us enough that they made sure we got vaccine when they got it. But as of last week, the ratio of African Americans getting vaccines to whites in Tennessee was 10-1. And again, knowing that we are the most vulnerable populations, it should have been flipped.
That's exactly.
I mean, as Dr. Saunders says, if you take a public health approach to this, when you know that the risk is not the same for all of us, you focus on those that are at highest risk.
Exactly.
That's a basic fundamental principle of dealing with a national public health crisis. But because we didn't have leadership focused on that, and quite honestly, because we had leadership that was racist, biased, and I'm going to leave it alone, but yes, there is a problem. Nationally, the rollout of the vaccine has not reflected those populations that need it the most.
That's exactly right.
Yeah.
That is exactly correct, Dr. Mildred.
So
if
I
we're
might,
disproportionately impacted as people of color, we should be first in line.
Exactly.
And maybe that's something, Dr. Sims, I'm turning it over to you. Maybe that's really what we need to have people thinking of and mobilizing around. I mean, if it's bad for us, they ain't gonna try to prevent us from getting it.
So yeah, here's the point that we know even before COVID, that being Black in America is a health risk. That the fact is that we are disproportionately victims of a lot of challenges that come with the addition of the stress that comes with dealing with a racist institution. I can't help but think that some of the suspicion that people may be having right now has to do at the timing of the release of the first vaccinations. There was a lot of talk about getting that done before the former administration went out of office. There was a lot of football playing with the vaccination itself. And I think a part of what we have to keep doing is remembering that COVID-19 is not the only disease that Black people are fighting in America. There is the original disease of this nation, which is racism, and you can add sexism into that as well, and the disease of commodifying and making a value, a dollar value on public health. So that even though the vaccination itself is free to people to get, we also have to talk about, again, because we don't know long-term effects about the care that people might need as we continue to deal with COVID going along. So I just want to put that in there too. And that has something to do with the reason why there might be what we might call a hermeneutic of suspicion for Black people who are always dealing with these other two things in addition to whatever are the health specific realities.
We're going to get ready for final comments shortly. But Dr. Hildreth, let me come back to you for a moment if I could. Dr. Choo Choo said, and I'd like for you to address this, that the vaccine does, if I heard you correctly, Dr. Choo Choo, does not prevent you from being infected, but rather ameliorates. Could you address that, one? Two, I had the pleasure of just the other day interviewing Dr. Cosette Lyons-Jones, who I'm sure many of you know, in Watts, the Watts Healthcare Corporation. And you mentioned, sure, I close I was listening, Dr. Hildreth. You mentioned the messenger RNA and the advantages of that process. I asked her about the new variants that we're seeing.
Mm-hmm.
And she said, using the messenger RNA in the way that it was used, and I'd like you to comment on this, creates a scenario where things can be, if another vaccine or if an adjustment needs to be made with new variants, the messenger RNA process makes that a little more convenient.
Yes.
So if you could address both whether or not it prevents and what it might mean in terms of these new variants.
So Reverend Thompson, the vaccine trials were not designed to answer that question, whether or not you got infected. They were designed to look for prevention of disease. 15,000 people got the vaccine candidate, 15,000 got placebo, actually saline. We let them go about their lives, and those that got sick got a PCR test and got diagnosed for COVID-19. However, some of those individuals could have had an asymptomatic infection and never come to the attention of the people running the trial. Those asymptomatic people could have spread the virus to others. So that point that Dr. Fuller made earlier, one of the most important questions we have to answer is, did the vaccines also block infection? We don't know that they do that. And because we don't know that, to Dr. Saunders' point, when you get vaccinated, you shouldn't change your behaviors. You should still wear your mask. You should still observe all those things that we've been asking people to do, because we don't know for certain that the vaccines block infection. However, a very clever study is underway to answer that question. The vaccine only elicits antibodies to the spike protein. So if you get vaccinated, the only antibodies you're going to have to COVID-19 virus is antibodies to the spike protein. If you get infected, you're going to have antibodies to all the other proteins in the virus, the nucleocapsid protein, the non-structural proteins. So we're going back and taking serum from the vaccine recipients and looking for antibodies to the other proteins. If anyone who got the vaccine have antibodies to the other proteins, that means they were protected from disease but not infection. Otherwise, they would not have antibodies to proteins. So very soon, we're going to know whether or not the vaccines blocked infection and disease or just infection. And to the other point, the other reason I'm excited about messenger RNA vaccines is the genome of the virus is a glorified messenger RNA. It's a positive strand RNA virus, which means that's equivalent to messenger RNA. So if the virus changes the base in its genome to, say, an A to a U or a G to a C, we can take the mRNA and do exactly the same thing. So we can actually make the mRNA exactly match the viral sequence very quickly. So she's right. mRNA is very convenient to making booster shots if variants arise, but we don't want to be chasing variants because that could be a very dangerous thing to do.
Gotcha.
Because one variant may show up that the vaccines don't work against at all. That's what makes me nervous. Suppose the variant emerged that the vaccines didn't work against. We'd have to go back to ground zero. Who wants to do that?
Yeah.
So my advice is let's send this virus to the pit. let's suppress it out of our communities so we don't have to worry about a variant emerging that we don't have a vaccine to. That would be really bad.
All right, folks, I want to go around now.
Sorry.
No, that's fine. No, great. You don't have anything to apologize for, Dr. Hildreth, at all. Nothing you said you should apologize for. And we appreciate you calling out the no good racist in chief who didn't do what he was supposed to do in this. All right. Let's go around. And I believe the Progressive National Baptist Convention, the PNBC, would like us to make the most reasonable and effective case for our people to be informed, one, and two, to be vaccinated for their own safety and survival. So I think we'll make that our closing argument. I want to go around and ask each of you, speaking to our people around the world, and many who are watching this, make your argument for being informed, one, not changing your behavior, two, and three, to be vaccinated. And Dr. Fuller, will begin with you.
We're in a fight for our ability to conduct life as not as we have known it, but as it goes forward. And the coronavirus, which is just simply trying to reproduce itself, it's not really trying to hurt anybody, but it doesn't play well. So we need all the tools in the toolkit that we can have to stop the virus. And when we stop its replication or stop the cases, we also stop the ability of variants to come up, because every time it replicates in somebody, that's a new opportunity for genetic mutation that helps the virus keep doing what it needs to do, which is simply survive. So the vaccines, although there are things we don't know about them, we do know that they stop disease, and we soon will know whether they stop infection or not. We do know that the preventions that we've been asked to use that we haven't done a very good job at do stop infection. So we need everything we've got. And you don't want people of color to be standing holding this virus at the end of this time because we didn't get on board the train. The train has left the station. We need to get on board, and we even need to flip the switch. We need to be taking it 10-1 because we're the ones most affected. So we need to do what we need to do and step out on faith and say, what we don't know, God will cover.
Dr. Choo Choo, make your case if you would, please.
What I'd love to say to my fellow people, both Black and brown, is that I hear you and I feel you. And I understand where this mistrust is coming from. We've been sold a bag of goods over and over and over that we didn't ask for and that we didn't need. So I understand that. As my colleague has said, though, we are in the middle of a pandemic and we have to save as many lives as possible. Unfortunately, our community is disproportionately infected by this. What I will say to you is that if you get the vaccine, I applaud you. If you choose not to get the vaccine, as my colleague has said, you still must wear your mask, socially distance, and wash your hands, and just keep away from as many people as possible until we can get this under control. All of us are important. We were brought here for a reason. God made sure we got here. It's important that you stay and do what it is you need to do. We don't want anything adversely impacting you and taking you out earlier than necessary. So as I said, follow your gut and definitely talk to your healthcare provider if you are confused. And if you're still confused, try to find a trusted source of information that can give you the information that you need to make an informed decision, whether you choose to take it or you don't. We're going to get through this, I promise.
Dr. Hildreth, sir, if you would please make the case.
Thank you. First, I agree totally with everything that Dr. Fuller and Dr. Saunders have said. We have the means to protect our communities from this horrible virus and the disease it causes. And to me, wearing the mask, avoiding crowds, doing the social distancing, and accepting the vaccine is an act of love. It's an act of self-love, but it's also an act of love for our communities. Because when you do these things, you're not just protecting yourself, you're protecting all the people around you in our communities. And we cannot let, with all due respect to all of us, we cannot let the hatred, the history of atrocities on Black bodies going all the way back to 1619, we cannot let that cause us to make a decision for self-harm, because that's what this would mean if we don't do the things we need to do to protect. So I'm pleading actually with people, get the information you need to make an informed decision and make the decision you're going to help us save our communities by either getting the vaccine or wearing a mask, avoiding crowds, and keeping the distance. I mean, either one of those two things will help us defeat the virus, but let's do one of those two things, please. And thank you.
All right. And the last word from our brother pastor here, we want to hear from, he is representing PNBC, and he is the one who will be carrying this word forward to throughout Christendom.
Reverend Thompson, I feel no pressure at that at all. I'm used to giving benedictions at the end of a worship service, so it is. I do want to say this, honestly, to my Progressive National Baptist family members. I want to say to you, we pride ourselves in being the denominational home for the social justice work of Dr. Martin Luther King. Let me give to us a quote from Dr. King that is less known, but is something he preached in Ebenezer Church during this time. He said, during his time, he said, "We have a moral responsibility to be intelligent." And that sticks with me in this moment. We have a moral responsibility to be informed, to use the information that we have, and to be a witness in the world for that commitment to having informed decisions by our people. I will say that the scripture does teach us that my people are destroyed for a lack of knowledge. We have to have the information. Again, thanks to this panel and having an opportunity to dialogue with you and to listen to you explain things. We have to listen to the experts that we have raised, that we have birthed, who have come to know a sense of their own calling in medicine and science as a result of being in our spaces. And we're grateful for that. We can't turn our back on the people who we have helped to inspire and to aspire to their work. And finally, a New Testament word that just says very simply to be encouraged, that be not weary in well-doing, for you shall reap harvest in due season if you faint not. Don't quit now. We are on our way to the promise.
Amen. I think the only thing that's left to be said is a very hearty offering of thanksgiving. And so please hear us when we say thank you for thinking it not robbery to join us in this very important conversation. We're thankful to and for each and every one of our powerful panelists. And we want to say a very special thank you for our sponsors that made this conversation take place. The Coalition to Transform Advanced Care, or CTAC as they're also known, and the Savannah Grove Baptist Church. And remember, brothers and sisters, the Progressive Hour is our hour. The three things I want to ask you to do before we let you go. The first thing is please follow us on Facebook, Instagram, and Twitter. And you can find us at Proctor Conference and at PNBC INC. Again, @ Proctor Conference and at PNBC INC. Then we want to remind you to please remember to subscribe to our YouTube channel. And again, you can find us at PNBC INC and at Proctor Conference. And then finally, stay tuned for the next Progressive Hour, which is our hour. I promise you,